organized here. Hey, everyone. Nice to see your names coming into the attendees. Wow, we had a lot of people ready and waiting. All right, are you ready for today's pre-discussion topic? So you can type your thoughts in the Q&A. We figured coming into Thanksgiving, we should ask kind of what we're thankful for or what we're grateful for. So I would love to hear from you about what brings gratitude and thankfulness for you right now. In the 8 or 9 minutes, 9 or 10 minutes we have until we get started. Very happy to be working. Very nice. Me too. I would be happier if I were working slightly less. New season of The Crown to binge. I just saw that. There's a new season of The Crown out. Oh, I got to go back and remember what happened at the end of the last season of The Crown. It's impossible for me to keep that in my head buffer there. And yes, I agree. Some good binging. And that's going to be, it's one thing I think when it was all historical, it was so fascinating, I thought, the first couple of seasons. But now that it's like getting into things that we've actually lived through, or some, you know, the big wedding with Diana and all that, I think it's going to be a little strange, but I'm excited about that too. Oh, Loris, thank you for your outstanding students who pulled together despite the pandemic. Agreed. Family's healthy. Oh my gosh, look at all this. This is great. And the tech to talk to our families, that is true. Although my mom can't do that, unfortunately, very well. Although she lives in an assisted living facility, and occasionally the director of the facility will come in with her laptop or iPad and we'll be able to Zoom. So that's nice. I was hoping to be able to go see her, but I don't think that's going to happen. So sad. All right, I'm looking. So the question is, for people just joining us, what are you grateful for or thankful for as we head into this Thanksgiving? Twin grandsons. Who has new twin grandsons? That's exciting. Oh my gosh, Lee. People with small children right now. I bow down to you. I don't know how you're doing it. Actually, it's truly amazing, truly amazing. Karen Sharp has a new puppy. Wait, can you post pictures on the Q&A? Probably not. What kind of puppy is it, Karen Sharp? Wow. Still working, and with my husband after 30 years. I do think there is a moment during this whole time of spending so much time at home with one spouse and family where I just went, oh, wow, I really do like my husband. That's a good thing. I'm very fortunate to have that. I'm grateful for that for sure in this moment. A whippador, a lab and a whippet. Oh my gosh, I'm going to have to see a picture of that. And what did we name her, Karen? Ooh, someone moved into a new home. That's exciting. Nisha. New puppy's named Nisha. We all are the new puppy parents here with Karen. Thankful for the break about to come up that gave me case road. Yeah, I have to say I agree with that. I think we're all very much looking forward to having a little bit more downtime after these next few weeks are up. And I don't know about you, but I'm counting down. You know, after today, there's only 4 more class days before Thanksgiving, and then only 10 more days after that of classes. And then they all will go safely home. We hope. Most all, anyway. Well, new season of The Crown is definitely topping the vote getter list here of things we're grateful for. That's fantastic. All right, we're going to get started here in just a few minutes. I am going to go off video for 1 sec, and I will be right back. Okay, I'm back. Seeing a few more posts here. So our question, for those of you who are just joining us, our pre-town hall question is, what are you grateful for or thankful for as we head here into Thanksgiving? Stephanie Pasha is now topping the list. We keep calling it our COVID-19 and around my house. It's our COVID-19, the food, all the binging we're doing, not just on TV shows, but on food. Definitely grateful for health in this moment. Oh, someone's got family coming home from college. I wonder how far away that is. And I hope they're getting a negative test before they come home. That's going to be important for all of us as we move into both the Thanksgiving break for students who are leaving now, and then later the holiday and semester break is make sure our students get that negative test within 72 hours of going home. The state has just come out with some guidance about that, which is what we were going to do anyway. So in that sense, it's good. I'm going to make sure everybody's going home safe. All right, we've got about 1 minute to go and 250 people on the call, and I'm sure a bunch on YouTube. Hi, YouTube folks. Oh, extra time with family at home before the kids leave the nest. Oh, that's a nice way to look at this not ideal moment, but to actually have that as a memory of once people go fly the nest, then we'll be able to have memories of this time. I do think there will be things about this time that we are very happy to put behind us, and other things that are going to stick with us as learning experiences and almost positive opportunities, I hope. Okay, it is 3:30. I am going to wait 1 more minute and then we will get started. Got lots of people still streaming into the room, up to almost 300 folks on the Zoom and almost 100 on YouTube. So welcome everyone. It's great to see you all. Thank you for sharing all of your things you're grateful for. I appreciate the people who are saying grateful to be able to work from home. I think we're all so fortunate that we've been able to make this work from wherever we are. Nancy Burnham, grateful for soup. I love it. Especially today, it is freezing. Oh, I'm not ready for winter. I'm in denial. Okay, it is 3:31. We are at over 300 attendees online, and good. So I think we should get started. You won't be surprised to hear that we've got a lot to talk about today, just that is pretty COVID focused. If you could go to this will work in the usual way. Again, if you have questions, you can type them in the Q&A. We do have a group of folks here in the sort of backstage with me to try and address questions as they come in. But in addition, we'll answer some of them in the Q&A part, in the discussion part. I know that we're in the midst of a big kind of change in functionality on the campus right now. So I'm guessing there are a lot of detailed questions, and that's okay. We're going to try and get through as many of those as we can. If we can't answer them, we'll take them offline and get them back with you. We're updating all of our FAQs on the website. That'll be done by tomorrow morning. And we'll keep working to clarify things that might need clarification and to keep you posted. Part of our most important job right now is to communicate with each other about what's happening and try to make sure everybody understands kind of where we are and what's going on. So that's really my goal for today. So if you go to the next slide, thank you, Kate. I'm grateful for Kate Beveridge. Who's amazing at running all this stuff. And Jolene as well, thank you. So today we're gonna update you on where we stand with COVID, both beyond our campus and on our campus. We're going to talk about the note that we sent out last night on the Heiden campus restrictions. We're going to kind of walk through that in a bit of a level of detail, it's going to be similar to what was in the note, but just so I can say a few words about these things. And then looking ahead, because, the next, between now and the start of spring semester and C-term breaks down into a few discrete chunks. And I want to get everybody sort of thinking about that and how that's going to work. So that's where we're headed with the topics for today. But before I get into a bunch more COVID talk, I just want to take a moment to just give incredible kudos, thanks, gratitude, all of those words that we were just talking about in the run up to this meeting, to all of you here at WPI and to the way that you have approached these last 8 months now or so with, ideas, with innovation, with a great, overcoming fear and anxiety, and with just doing the right thing on behalf of our students, on behalf of WPI. Today, the last couple of days have been hard as we've really seen where the cases are going and tried to make the right decision for the campus and for the students. And I have to tell you, this morning feeling a bit, bit beaten down and nervous and just, concerned, feeling like we all kind of feel right now. And 2 things happened today that have put me making me more feel like myself, which one is that I went to the wonderful celebration of A-term that Wale and the Provost's office put on today, where we heard from a bunch of different faculty members about ways that they have taken this moment and made it into something that's much better than what it could have been, and including, you've heard about Dustin Heilman, and his light board. You've heard about some of the classroom innovations. Michelle Ephraim down there in the lower right used the fact that her class was on Zoom in D-term and A-term to be able to bring in authors that we would never have been able to expose our students to previously. So that's her there with a sci-fi author that she had in her class, I think. And we heard about the music programs and the arts and theater programs that our students have been able to do at that event this morning. And one of those images is in the upper left here. We heard about research that's going on in our labs, and Kai Zhang there in the middle with doing work on COVID-related research and through Practice Point. It's truly amazing. And then I just want to take a minute to especially call out our health team. our fabulous new director of health services, Lisa Perlman, who most of you probably haven't met. I have to say, I hardly met our last director of health services in the first 6 years I was here. And now, that we have Lisa here is new and amazing. And I'm obviously interacting with her a lot. Whenever you get the chance to meet her, she's fantastic. And her team that's working so closely with her, Chloe, Jen, others on testing and tracing and making sure that all of the students, and you'll hear about some of this today, that we're helping and supporting through either a diagnosis or being a close contact and being in quarantine. Like, they are all over it. They are representing WPI in a way that would make every single person here proud. All the people working on CERT behind the scenes, especially the current team where it's been so crazy, Rachel LeBlanc and Colonel Ron Bashista and Jeff Solomon and Philip Clay, who are leading it, as well as Rita Rao and Chris Billiar from the academic side, and Patty Patria from the operations side. I'm sure I'm forgetting people. This is like an Academy Award speech, and I should not have started naming names, but I just want to thank you for what you're doing. I want to respect deeply the amount of thought and care and innovation that goes into what you're doing. And that's going to be called on again here in the coming weeks. And so I know we're all tired and pissed as hell at this virus for continuing to inflict this all on us. Maybe that's just me. But we've shown we can do this, and we can make things good for our students. And we're going to continue to do that. So I just want to start with a huge amount of gratitude. And that's really what guides us. If you go to the next slide, our North Star is all about all these things that all those folks in the last slide and all the rest of you are doing each and every day. It's about keeping our community safe and healthy, which is always the top of mind for us, and serving our students while that's happening, supporting you all, one another, keeping our family together, treating each other with that great care and respect. And especially when nerves are frayed, that's more important than ever. And I've really seen that happening a ton over the last few months. And I want to thank you all. And again, continuing to serve our community beyond WPI. And as we think about our actions on this campus, we always have to do so conscious of the fact that we are not an island, that we live within a community, and we've got to continue to serve that community. So let's talk a little bit about where we are, starting with the COVID update, which is on the next slide. So my guess is I don't have to show these plots to any of you, because you're all as addicted to them as I am each and every day, logging in to look at how we're doing as a nation, which is on the left, and as a state, which is on the right. It is absolutely clear that this virus has dramatically increased in prevalence across the US and here in the Commonwealth. We were doing pretty well for many months there after the early peak. We are essentially now back at the same number of cases as we were at the peak when this virus started. I will tell you, the piece of good news is that our ability to treat the virus is much, much better than it was. The cases are distributed across the age spectrum in a different way. They're skewing younger, which isn't great for us, but is better in terms of hospitalizations and morbidity rates, deaths from the virus. But we are seeing hospitalization rates go up. We are seeing, the field hospital has been being reset up here at the DCU Center in Worcester. I would say the medical community now is much better equipped to deal with a surge than they were back in the spring, but it's still an intense time, is what I would say. And we see it right here in our own city of Worcester as well. Cases have increased fairly dramatically in the past month or so. And here at WPI, we've seen it as well, which is what's on the next slide. So I want to just spend a little bit of time on this with you all to kind of explain where we are. So if you go and look at our COVID dashboard today, this is what you see. You see the, onesie, twosie cases, and then going up to twosie, threesie, foursie cases, and then whoop, 10, which was what we woke up to Monday morning. From Sunday's testing. Right now on campus, we're testing Sunday through Thursday. And so what usually happens is we test about between 12 and 1,500 people a day. Many of the results come in overnight and show up the next morning. And, but then the rest of the results for that day trickle in during the day. And when it updates, it's actually looking at about a day, that the tests that were done the day before. So, so this 10 that you see here was an update from people who were tested on Sunday. What I can tell you is during this meeting, the dashboard's going to update again to show the results of Monday's testing, which what you'll see is, the worry was, is that going to go to 20 or is that going to stay high? And what you'll see is it's come back down. It was 4 yesterday. So from people who tested on Monday, and we received the results yesterday. Sorry, that's a little bit confusing. With the update of the dashboard at 4 o'clock today, you'll see there are 4 additional cases being added. So in fact, the good news is it's not going up more, it came back down. And that was a key component in our thinking about what to do. Obviously, when you wake up and see that number of cases on Monday morning, we had already been talking about the rise in cases, and this leapt us into action. Just to say a little bit about what these cases are. They are mostly students. That wasn't necessarily the case several weeks ago, where we were seeing a higher percentage of the cases being from staff, maybe a third. That's not true of this maybe last week or so of cases. They are mostly students. There are a few staff in there, no faculty positives. And it's one thing if you say, well, we know there's an emerging cluster over here, and yeah, we expect to get 5 more positives out of that cluster, and you can explain away sort of some of those positives. A few of them are part of one cluster that we're tracking, but many of them were not. Many of them were other students who were just randomly getting their regular testing in Harrington, and not randomly, we're getting their regularly scheduled testing in Harrington, and we're coming back positive. And so we talk to them, we get them into isolation very quickly. Again, kudos to the health services team. And we talk to them about, what they've been up to, where do they think they might have become infected. And in some cases, they honestly don't know. In other cases, they say, I went home last weekend, or I went to visit my girlfriend at another campus, or, oh, I was at it's not big parties that we're seeing, but we are, with smaller group, what might nominally be sanctioned gatherings, have been sanctioned gatherings, but maybe where people got a little bit lax on the mask wearing and distancing. So we've spent a good part of the last 2 to 2.5 days really thinking through, what does this mean, and what should our next steps be? And as we do that, we looked back at our campus operations status levels. So if you remember, way back in like July, we were thinking about how to ramp down operations if we needed to. And you remember back in the spring, we were in what we called severely limited operations, right? When it was only those emergency responder type folks that were on campus. We've been in this tech flex on campus mode. And what we said was, look, there are certain triggers that are going to cause us to look at what we're calling a stay in place mode. We actually called this 2-week remote, if you remember, way back to the summer, but we're now calling it stay in place mode, where we're not sending people home, but we're basically locking down the campus, and we're not having any real in-person activities, including academics. And so we were discussing, frankly, whether to go all the way to that mode, or whether in fact there is something slightly in between that would still allow students to take part in their academics. And what I would say about this is, these status levels are great and the triggers are great in abstract. That's the theory part, right? In practice, you have to be in the midst of it and assess the conditions on the ground as you find them. And so what we decided to do, if you go to the next slide, was actually do what we're calling this heightened campus restrictions, which is a little bit in between tech flex and stay in place, but it's a modified tech flex approach, where we are still doing learning, but we have more restricted operations on the campus beyond that. And so that's what we'll walk through with you, and share, our plan. And just to share a little bit more, if you go to the next one, insight into kind of how we made this decision and how these decisions are made. So when we're making decisions about putting restrictions in on the campus, The front and center team is the health team. They are the ones who are coming forward. So this is Lisa Perlman and her team, and Charlie Morse as well involved in this, all working with Philip Clay, are looking at the conditions on the ground, are assessing our statistics against what we've said our triggers are. And the triggers aren't so much about triggering a certain decision, but they're about triggering a conversation. And that's what we've been doing over these past many days. So the health team is driving that conversation. They're doing so in consultation with CERT and with the senior leadership team. The goal of the decisions right now is all about, one, breaking the transmission cycle. So reducing the opportunity for disease to be transmitted either from outside the campus to inside the campus or within the campus community. And two, to make sure we've got all of the resources broadly defined. I'm not talking about money here. What we need to be able to support our students in this moment. Some of that's academic, but some of that is about making sure that we have and that we're confident where we won't overflow our isolation and quarantine space. Okay, for example, that we're not going to overwhelm our healthcare workforce with the amount of cases they have to deal with for a sustained number of days. And to make sure that we aren't in a mode of high levels of community spread, which would be not good on the campus. So we were looking at the data and we saw both the daily and the weekly positive test rates. They're still manageable. They're still very low compared to the Commonwealth, compared to Worcester, but they're headed in the wrong direction, definitely. And as concerning as that does say 10 positive cases that showed up on the dashboard yesterday, where the number of close contacts that each case has appeared to be going up. We now have over 100 students in quarantine, not in our quarantine space. Many of them are quarantining either at home, in their own residences, in their residence halls, if they're able to do that safely, some in our dedicated quarantine space. But once you start getting into numbers like that, where you've got, many students in quarantine, you have to just start to ask yourself about our ability to make sure we can serve those students. And also the fact that students had so many close contacts was telling us that we may not be fully observing all of the health and safety protocols that we need to. And so we felt the need to make a serious move that would get people's attention. And then the last piece of data that I would say we used here is that there is no evidence of transmission of this disease in the classroom or in the lab here on campus or on any other campus that I am aware of. So the true academic part of what we're doing in classrooms, in labs, that's research and academics, is safe. I will say we have a little bit of evidence of student teams meeting outside the academic setting. So IQP teams, say, for example, where we have seen a case of transmission there. So when you hear about us saying meetings must be virtual, that's why. When they're in the lab, it's a controlled setting. In the classroom, it's a controlled setting. We believe that is very safe. It's the outside and more informal parts of the work that our students are doing, whether that's social or even academic, that we feel like we need to take a step back and make sure that everyone is paying very close attention to the safety protocols. So with that sort of landscape, we made the decision to go to this heightened campus restriction, set of heightened campus restriction, which we sent you all the note about yesterday, late afternoon. All of the things I'm going to show you on the next few slides are straight out of that note. I'm just going to walk through them relatively quickly and then happy to answer questions about them and clarify as folks need it. You'll notice that the note was largely directed towards students because it's really their behavior that we're trying to impact here. But of course, all of us, we need to help enable them to do the right things and also be models of that behavior. So the idea here is that students should only leave their residence hall or apartment or off-campus house or home if they're attending school from home to come to classes or study in the library or designated studies place or perform work in a lab. So research is still possible. So do academic things, research, teaching, studying solo, picking up food. So students who are on meal plans can pick up food. They can exercise outside in a physically distanced way. I think it's really important that people try to stay healthy, and being outside is fine. Seeking medical care, they must be they must, and we all must continue to participate in our regularly scheduled COVID testing. Very, very important right now. And going to and from work. So many students need these jobs to be able to pay their tuition and support themselves. And I would not tell anyone they can't go to work. Re-emphasizing the real importance of the health and safety protocols. So 6 feet distance. I went in today to the campus center. I'm like, you guys get further apart, get further apart. And I think we've all got to be a little bit more bullish on giving some direction to students where we see things happening that we're not comfortable with. We're encouraging grab and go dining. We're going to have 1 seat per table in the campus center and other dining locations, at least 6 feet of distance at all times. Because when you eat, you have your mask off, and that's concerning. So mostly grab and go we'd like students to do. Let's go to the next one. Sports and rec center, we've decided to close. Gyms are a site of transmission, although I don't know that we have data that there's transmission in our gym, but it's just, again, we're trying to send a message that we're moving to a more restricted set of operations for now. And by the way, I should mention, we put this in place right now only through November 30th. We will be reassessing. I can talk more about that. And it's possible we'll keep it. It's possible we'll back off a bit. It's possible we'll go to something more restrictive. So we need to see how the cases evolve over the coming day to a week or so. So there are certain in-person activities that students can do and that we can do. You can attend classes in person and labs. No in-person meetings. So it may sound like it's aimed only at students, but frankly, my intention is that it's not aimed only at students. I think this should be all of us. We should not be meeting with, multiple people in a group. Obviously, if you need to have a quick conversation with one other person and you're 6 feet apart and masked, you're probably okay. But in-person meetings in general were really discouraging. So project teams, no clubs or activity meetings, advising and tutoring, we're thinking that should all be done virtually in this campus restricted phase. We're going to restrict tech suites to 1 person at a time. We're going to no social events, no social gatherings, no parties. So that's the big message, is that people should really take it way back in terms of the amount of interaction that they're having, so that we can stop the cycle of transmission and make sure our health system does not get overwhelmed. That's really what we're after here. And keep the students, of course, and all of us safe and healthy. For employees, we didn't put this in the message, but I wanted to share it with you today. I really do think folks can work with their supervisors. We're not flipping to a remote work mode. We're not like massively changing there, but I do think folks should consider working remotely more often. And certain offices may wish to go remote at this point. I would say employees should work with their supervisors. And as long as the work of serving our students and the work of our various offices can be done, can be supported, folks should consider more remote work. Next slide. Visitors, clamping down on that one. No visitors allowed on campus, with a few exceptions that are there in the bullet. So employees who are not regularly on campus but come in through this approved visitor process, that can still continue, although I would discourage it. But if you need to come to campus for something, obviously you can still use that process. Certain vendors, we need them, so they will obviously still be on campus. And research activities, we have very few visitors for research activities, but we do occasionally have them, and we vet them very carefully. So those approved forms that people are already using, people can continue to use. And then just re-emphasizing the safety protocols. Use the symptom tracker daily. I must admit, I had gotten lazy about using the symptom tracker. This is being recorded. I shouldn't have said that. Everybody should use the symptom tracker. I did mine this morning. Please, please, please continue your COVID testing schedule. Even if you decide to work more often remotely, come in on the day of your test and get that test done. Please follow social distancing and face covering protocols when outside your office. In our case, your office, your closed office. It's very important that we give the right impression to our students and that we're good role models. Still washing hands frequently is important, and very, very importantly for everyone, if you feel sick, please stay home. Please don't come to work. Okay, so that is just to take a little pause there for a second. If you go back for a second, Kate. So that's kind of the end of the heightened, the kind of current state, right? So we are in this thing we're calling heightened campus restrictions. We're in it until at least November 30th, which is the Monday after the Thanksgiving holiday weekend. So we will be reassessing it late this week and early next week, and sharing with everybody what the plan will be for November 30th going forward. But until you hear something else, I would say assume these heightened campus restrictions are going to continue. And we need to see the numbers and how they're doing. We have to be driven by the data and the cases and our health team's assessment here. So that is the plan. We obviously have 2 more weeks of classes after the 30th. I believe that many students will decide to go home over the next week or so, and perhaps more than we're planning to previously. And again, I would encourage that at this point. I think that's totally fine if that's what students feel comfortable doing. Get that test within 72 hours, get that negative result before you, and then folks should feel free to travel home. And so my expectation is that the campus will be significantly less populated in the 2 weeks after Thanksgiving. Something like half the students we think will not be here, at least. And so it's that also makes this easier to manage because it's automatically de-densifying the campus even more. All right, so what I want to do for the rest of the time then is talk a little bit about what happens after Thanksgiving forward. There's a kind of a lot here, and you don't have to like memorize this or snap a photo of the screen or anything. We're gonna share all this with you in written form, not immediately, but you'll be getting sort of a summary of this. But I just wanted to share kind of how we're thinking about it so you can start to think about it this way too, I hope. So it's, we think about the time between the end of Thanksgiving break, so that Monday the 30th, and the beginning of C term or spring semester. And it actually breaks down into several discrete chunks of time. And what I want to do is kind of walk you through what each of those chunks of time is. And then again, we'll get this table turned into something we can put on the website or something so people can make sure they find it and can understand it. So from today until Thanksgiving, so I'm in the second column there. So that's now, that's you are here, right? We're in this heightened campus restrictions. And in terms of testing, we need everyone to continue with their regular testing appointments. Please, 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 you do it. Tell your friends, tell your students, continue getting those regular tests, and we're going to continue chasing you down if you're not doing that. So we need everybody to keep getting tested so that we can continue to track and monitor and have that early warning system if we're seeing more disease progression on campus. So after Thanksgiving, there's 2 more weeks of B term and fall semester. So right now, what I would say is we're in this heightened campus restrictions mode unless you hear from us formally otherwise. And frankly, you're going to hear from us formally otherwise either way. But that's kind of like until further notice. No, and certainly up until the 30th, we will be in that mode. And then after that, we'll consider whether we change either back to more of a full tech flex level on the campus because it's so de-densified and the disease level has diminished significantly, or if we need to go to a more restricted status, which we'll be thinking about over the next few days. What will happen over that 2 weeks in terms of testing is, again, regular testing continues. Keep on your testing plan all the way through the end of the semester, the end of the term. There will be slightly less days available for testing for all of us because there's going to be a lot less people on campus. So we're going to scale that back a little bit, but it'll be Monday, Wednesday, and Thursday of those 2 weeks that you can get testing. You remember you couldn't schedule appointments before. You should be able to go in now and schedule those appointments. And I think you're going to be hearing about that in an email in the next day or two, but you should be able to go in now and schedule that. So then B term is over, fall semester is over. Yay, we made it. That's something. So then we're here on December 12th through the 22nd. So there's about a week and a half there when campus is kind of open normally, but no students are here, and but people can still come to work and all that. So what I would say about the winter break in general is that people who can work remotely should. we should just take this opportunity while there aren't significant numbers of students on campus, hardly any, and folks should work remotely if they can. Obviously talk with your supervisors about that, but I think that we should expect for more of us to be working remotely more often during the holiday break. If you are coming to campus, if you are accessing campus at all, you need to keep in your once a week testing protocol. And there are only 2 days for each of those weeks when testing will be available. Again, we will send you notes and make sure folks know about this, and it'll be that way in the scheduling app. But the week of the 13th, it'll be Monday and Thursday, and the week of the 20th, it'll be Monday and Tuesday. And that's because as of Wednesday, the 23rd, actually, the next one should say, that's my bad, 12/23 to 1/3 is our annual winter holiday break, where the campus is essentially closed to most employees. I know that some of you work over that break, and I thank you for that. We are going to have limited testing for essential employees who are on campus during the break, and we'll figure out the details of that. We may do it at the trailer, we may do it in Harrington. We're still working out some details, so stay tuned, details to come, but there will be some testing available on campus even during that time when the campus is closed to most employees. And then starting the week of January 4th, there we are in 2021. Nope, go back, please, sorry. I wanna talk about it here first, thanks. So starting the week of the 4th, and I don't expect that everybody's going to rush back the week of the 4th. Again, I think a lot of people will probably continue working remotely until we get closer to the time that the students are returning. And one thing that we have decided that we'll announce here is that Pathway 4 offices, which we were before the disease was rising, thinking about bringing back in January. We are not going to bring them back in January. We just don't think it's a good idea to bring more employees back at this point. I'm sorry about that. If you wanted to come back, if you weren't sure about coming back, yay, there you go. But people will start returning to work, and we will have an onboarding testing procedure for people coming back, which will be something like, and again, we'll send you all more details about this, but it'll be something like, the week you want to come back, you come in, you get a test, you go home, you wait for the result. So you don't just come in and start working. You get at least one negative test, and then you wait at least a couple of days, I think. And then you come in, if you want to come in on your first day back of work, you get a second test. And it's okay to work that one day while you're waiting for the results. But it's basically 2 negative test onboarding plan. And then you would be back into your once a week testing until the students come back. So there'll be onboarding testing for everybody, because a lot of us are going to be off the campus for a while over the break, and we want to be sure we're really safe about coming back in, and that the community itself is really clean, if you will, from the disease. So now, Kate, thank you. One more slide looking ahead to January. So this says a little bit of the same thing as that last column in the table. So starting that week of January 4th, we'll be having that onboarding testing regimen available, understanding that not everybody's going to be coming back that week of the 4th. If you aren't coming back till the next week, that's fine. You can do the onboarding regimen then. You can make that work for you. And again, after you onboard, you'll be back in your regular testing protocol. Before the students are back, probably everybody will be on once a week. Already said Pathway 4 offices are not going to reopen in mid-January. We'll let you know whether later in the spring is possible. And just in terms of what's going to be happening with the students. So our current plan has C-term starting, I believe, on the 21st of January. We would do this phased return of students, much like we did in the fall, with them coming in and testing and quarantining until they have negative tests, and and they're all doing pre-arrival tests as well, and then doing their onboarding tests before they get back into regular testing in the term. But I have to say that if these levels remain high, and we're looking at this right now, I am thinking about pushing back the start of C-term to early February. So no more than a couple of weeks, probably more like 10 or 12 days. Stay tuned for more on that. We will decide in the next few weeks about that. We're looking at the different implications of that. I think the later we go, the closer we are to anything that might be coming along vaccine-wise, the closer we are to getting out of winter. So we will be working, I've already started speaking with faculty governance leaders about this possibility, and we'll be kind of trying to look at it from all angles and make sure there aren't some unintended consequences of it. So stay tuned on that one by the time of our next town hall. I hope to have more info for you on that settled in C-term calendar. So lastly, how you can help. Thank you. So be a role model, stay vigilant. Please follow our health and safety protocols. They're not just ours, they're everybody's, on campus and off campus. So, so important. I know Thanksgiving is so many of our favorite holidays. I'm asking you not to gather with those outside your immediate circle for Thanksgiving. We're asking that of our students, and I'm asking that of you as well. I want to thank, I know some of you volunteered to be on call, be the sort of National Guard for our health services in case of a surge that where we might need more assistance. I want to thank those of you who have volunteered to do that. It's so important. I want to ask, and this is probably mostly an ask for faculty, to think about being as flexible and supportive as you can reasonably be with your students in the last week of the term. Look, I know there's nobody more flexible and supportive than all of you. I'm just saying this out loud as we're hearing from students who are thinking about maybe traveling home early and worried about missing a class or something. It's things like that. Where I wouldn't be flexible, do not be flexible on the current Heiden restrictions. We have to follow those. But in terms of the sort of, needs, academic needs of our students, be as the reasonable, flexible people that I know that you all already are, and just be sensitive to the fact that students are stressed. Oh, I forgot, I didn't tell my whole story at the beginning about the two things I did today that raised my spirits. One was going to the celebration of A-term that Wally ran with so many of our amazing faculty. The other was I had student office hours today. I did them virtually. And I met with about 10 different students from all across the campus, talking about all sorts of different things. And I have to say, they are incredibly inspiring, amazingly resilient, and they want to make this work. So they will work with you because you work with them, and I'm sure they're getting some of their resilience from you. So I appreciate that. Watch the communications, because there's a lot here, right? A lot of details, a lot of stuff coming at you. I know we're throwing a lot of stuff at you, but just make sure you keep your eye on those comms, and not just the emails that come from me, but also the emails that come from, whoever you're part of the campus, that's academics or student affairs or elsewhere, operations. But also use that We Are WPI website, where again, we're updating all the FAQs, many of the FAQs, to reflect the current status in the next day or so. So you'll see those. Everything we send out, we put up on that website. So that's a great resource, and check it often. And then the last thing I'd say is just take care of yourselves and each other. I know this feels like the trends are headed in the total wrong direction, both on the campus and beyond. And without, in some ways, it feels like an end in sight. But the truth is that there is an end in sight. And just today, Pfizer released the latest results of their phase 3 trial, where in fact, through the end of their phase 3 trial, the 95% effectiveness of their vaccine was sustained, and that they're going to be applying for emergency use authorization immediately from the FDA, and that's likely to be approved. The Moderna vaccine is not far behind. I believe that once these things start getting deployed, it will go, I hope that it will go faster than we even imagine. And so I believe that, sometime later in the spring, at the latest, hopefully the summer, we will be getting back to more of a sense of normalcy. Having a vaccine that's 95% effective is huge. There. It'd be one thing if it was only 50% effective, but it isn't. It seems extremely effective. And now it's just about making it and deploying it, which is not easy, but those are problems that people like us, know how to solve. So we know there are a lot of people like us out there, and I'm really confident that that we can start to see the end here. And so this is about getting through these next few months as well as we can. And that's about taking care of ourselves, taking care of our loved ones, taking care of our colleagues, treating one another with the love, care, and respect that I know we all have for each other. So hang in there. And then lastly, as I close, don't forget to do all those basic safety things. That's what we can all do now. What can you do to help? Wear a mask, stay 6 feet apart, keep within your social circle. These are some adorable new comms that we've put together. Don't 3.1 forget to follow the safety protocols about wearing a mask and washing your hands and staying home if you're sick and keeping things clean and stay 6 feet apart. Thanks to Marcom for putting all those things together. Let's protect the herd, and thank you. So I'm happy to answer questions we have about 20 minutes left to hear from all of you. And Kyle, do you want to jump into some Q&A?
Sure, thank you. I think we'll start with a couple of questions on testing.
Sure.
Are the tests reported on the dashboard only the asymptomatic or surveillance screening tests, or does that include symptomatic testing outside of what's done in Harrington?
It does include both, includes all the testing that's done at WPI. So we have, so many of the close contacts are either if someone reports as symptomatic or if they're a close contact, we send them over to what we call the trailer. So that's health services actually administers those tests. And the dashboard does include both. And someone should tell me if I'm wrong about that, but I think I'm right. So what that means is on any given day, the cases are probably some combination of cases we expected because either somebody showed up symptomatic or they were a close contact that was probably pretty sure they got exposed. And then sort of brand new tests.
Thank you. Assumption tracks non-compliance on their dashboard. Is that something we would consider doing here at WPI?
So I haven't looked at their dashboard in terms of what kind of non-compliance it is. I will tell you, we track non-compliance with testing, if that's what you mean, Adam. I see that's Adam, I think. And so we do track it. We have every single day, we have a dedicated person on the faculty and staff side who is following up with people who are not compliant with testing. We also have a dedicated full-time person on the student side who is following up with students who are not compliant. I can tell you, having looked at the data, in a typical day, we will have, so I would get nervous if we were, say, more than 10% out of compliance on a day. And that's very rare that it happens. And usually it's sort of first thing in the morning. And by the end of the day, we're back down to 2 or 3% non-compliance or 3 or 4% non-compliance. So we do track it very closely and we have people dedicated to driving that non-compliance down. And in fact, we have barred from campus several dozen students who have been repeat offenders on the non-compliance with testing. I see you're saying more social distancing and mask compliance. I don't know, how do they monitor that? That's interesting. I can try to find out.
Thank you.
I would just say today, based on my own walking, like I could have the presidential non-compliance. I today told 3 groups of people in the campus center to leave more distance between them.
A few questions on the heightened campus restrictions.
Yes.
Students allowed to visit offices or have in-person appointments with staff?
So I would say typically it would be better not to. So generally no, is what I would say. It might be that you have an office open and if a student needs to walk in and get some help, that's okay. If you're planning a meeting, I would say plan that meeting for Zoom. And beyond that, I'm not sure I'm smart enough to answer the question. So I would say talk with your supervisor or your division lead about the specific situation. But the intent here is to reduce the reasons. So most students shouldn't be leaving their room for most things, right? And so they should want to connect more electronically as well. So I would say right now I would err on the side of less in person.
Thank you. And how about allowing students to use office or department spaces to study? Study spaces are okay to use. I would say, I would try to look at distancing in those spaces and making sure that it's, 1 seat at a table, or I would rather not have students be gathering. We are tending to we're closing the lounges in the residence halls. Philip, do you have or Wally, do you have a thought about that particular question? If there are places where students gather to study, I would tend to say not.
Yeah, I would agree, Lori, that we have a lot of spaces that students generally study in, including open rooms in the campus center, for example. And I think that is, in general, because academics is the top priority, that if students are doing that in a socially distanced manner and they're not and it's just a single student as opposed to a group of students who are doing project work, we know that's not allowed, but individual study, I would say, yes, that would be allowed. Wally, I don't know if you want to add anything to that.
No, I would concur with that, Philip. I think individual study is fine, and really, if you really have to, socially distanced interactions, should be with close contacts that you're very familiar with.
Thanks, guys.
Thank you. There are a couple of questions about NQP teams working in labs or in the shops. Could you provide some clarification on if they can continue that project work in the lab?
Yes, they can. Lab-based or shop-based project work can continue, academic work. We need to step up our safety protocols there and really do everything we can to make sure people stay apart. But yes, that may continue.
Thanks. One of our colleagues noted that they have heard students mention that their parents are coming to take their student out to dinner for Thanksgiving. Is that allowed, and have there been communications about that?
So student not going home for Thanksgiving, but parents coming to student for Thanksgiving. Help. Emily, Philip, who can help with that one?
I can help out. So we had some early messaging, right when we announced our Thanksgiving decision that said, if you went to dinner at a restaurant in Worcester, that would be acceptable. That our visitor policy was still in place, but we've certainly, if you were staying local, that we were okay with that. Clearly, the circumstances have changed, and so I think there's an opportunity for us to more clearly message. And we have said no visitors, but I think we can definitely give some clearer messaging about that. So I think we would highly discourage that at this point.
Yeah, and given that it is, a violation, I think, of the visitor policy probably. So thank you for the question. Actually, that'll help us sharpen our messaging. I will say I've heard a lot of people, including some faculty and staff, expressing concerns about students not being truthful about going home for Thanksgiving and coming back, and a lot of concern about that. I had a dedicated conversation with the head of the Interfraternity Council about that during student office hours today, and asked him, is this something you are hearing and seeing? And he said, look, if you would have asked me 2 or 3 weeks ago, I would have said yes. But now everybody gets how serious this is, and everybody's changing their plans and is gonna do the right thing. So that was, to me, very heartening to hear.
Thank you. Does WPI have any plans to provide a vaccine? This is an optimistic question. A vaccine if and when it may be available, the same way we provide flu vaccines?
Yeah, so I hope so is the answer. I don't yet have that plan, but for our next trick in trying to work with the state for higher ed is going to be to try to position higher ed to be a help in the distribution of vaccines, and also hopefully get to a reasonable point in the line of getting vaccines, obviously not ahead of first responders and healthcare workers and other people with conditions where they really, really need it. But I hope that keeping our colleges open and running well is going to be high on the list of everyone. So I think that'll be an issue that we'll be working over the coming couple of months. And I really hope that we'll be able to offer something on the campus. The one thing I will say is that because of the environmental challenges of keeping the Pfizer vaccine at least very, very cold, that may be limiting in terms of how and where the vaccine is given. But I think all that's to be worked ahead of us. If it's at all possible to do it, we will do it. 100% we will try. And I think we've got all this infrastructure in place now about, for in the testing facility, for example, I could just imagine us just lining them up and given the vaccine. So I'm hopeful we'll be able to do that sooner than later, but I don't know how soon. Not soon enough, probably.
Great, thank you. Should staff continue to, or departments continue to pay student workers who choose to go home next week and therefore can't come back, as we did in D-term?
Ooh, that's a really good question. If they can do that, I think if the answer is if they can do their work remotely, that should work, but I may need to get back to you on that unless someone else on the call, like Michelle, knows the answer.
And this is Kristen. I can help a little bit.
Thank you.
Yeah, we are, if work can be done remotely, we are definitely encouraging that. And if there's other work, if they traditionally maybe do office work and they can do work remotely, that's a little different than traditionally. We would like to encourage that. We know the students are working because they need it and they need the money. So any opportunity we can do to find work for them would be wonderful.
That's great. Thanks, Kristen and Michelle. Appreciate that thinking. And again, we'll try and make sure we get guidance out to folks.
Is the outside track, will that continue to be open?
Yes.
Yes.
Yes. Yes. Yes. Yes, Ken Stafford, it will.
Great, thank you. An international student asked if WPI will be allowing students to return to campus after winter break. And if not, the student will go home. So how should we approach this?
You mean early January before the term starts? Is that what is meant, I think? So if they're a research student, if they're a student doing research in a lab, their PI is able to submit their name for access to campus over the break. They would need to come in and do our testing program stuff. But then, yes, I believe they could be on campus. And if Bogdan or anyone else thinks that's not the right answer, I invite you to speak up.
I'm going to jump in here. I'm going to beat Emily Perlow to it. But I would advise that student to talk to Colleen Callahan Pandey in the International Student Life Office. I think what the question actually is referring to what's our plan for C-term? If we're planning to be remote in C-term, I would go home to China now.
Okay.
But they wouldn't go home if we were going to be open. And so that Colleen, who's our International Student Director of International Student Life, is the best resource for that student. So please send them to Colleen. She helps students navigate this question all the time.
Thank you so much. That does make sense. Again, our intention is to be back in person, but we'll have to obviously keep our eye on the virus as over the next few months. Wear your mask, wear your mask, wear your mask.
Thanks. Speaking of C-term, one of our colleagues notes that the lack of holidays and breaks are taking a toll on faculty and staff and students. If we adjust C-term, could we still incorporate some days off?
It's a good idea. We should ask the calendar team to look at that as they are looking at, as long as we're adjusting anyway, we might as well look at that. So I think point taken.
Thanks. A couple of faculty questions.
Sure.
Our faculty who have been teaching remotely via Zoom from home this year, will they be encouraged to continue to do that in C-term?
We're not changing our guidance to faculty. The flexibility that we've offered to faculty in A and B term is going to remain in C term, and I expect D term as well. Again, I would say that's not true at every university. I'm hearing more and more places that are pushing to require faculty to come and teach in person. That is not going to be our approach. So the approach we've had previously is going to be the approach we'll have for spring. And I would not characterize that approach as encouraging anyone to teach remotely. I would characterize it as giving faculty the flexibility to deliver their courses in the way that they feel they can do it most effectively for the students and for their own situations. With the one potential exception being some of the grad courses were definitely sort of flipped to remote more as a policy. And so not knowing the specifics, I don't know if that's maybe what someone's asking about. But for the courses that can be a kind of hybrid, that is at the faculty member's discretion.
Thank you. And if we delay the start of C-term, will that mean that faculty end up working beyond May 15th, the end of the 9-month contract?
Yeah, it would. And that's one of the reasons why I'm saying we're going to look at it. So because those are the kind of things we need to dig into and understand, obviously. It would mean a longer break now coming up. And
and a little bit longer past May 15th. So that's what I want to understand. What are the implications of that? Obviously, we want to work with faculty to make sure that's possible. Want to think about summer sessions and what that would mean. Want to think about summer salary and what that would mean. And so we'll be looking at all those aspects of it before we make a decision.
Thanks. Can you share some more info about the health services volunteers? Some people haven't heard about that.
I can't share too much more, but I could ask someone else too. But you know, we need some volunteers to help us. So imagine that we had 10 cases, God forbid, 10 cases a day for a while. Case management, runners to and from the townhouses to help support students who might need medicine or food. Just a lot of different supporting and almost administrative tasks to support the health team so they can stay focused on delivering the healthcare to the students. It's really about that. And I think we, through the care team and others, sort of put out an informal call for volunteers. And I think they're set now, but if someone is interested, I think you could email Charlie Morse.
Thanks. One of our colleagues notes that some of the students they work with have asked if there'll be more general enforcement of COVID regulations. They seem to be upset that their fellow students are flouting regulations and would like to see a more codified response from the university.
Well, like I said, I was personally enforcing them in the campus center today. So I do think it's a good question, and it's a good message for all of us, right? We love our students. We don't want to scold them. I will say they have been very good at policing each other. Policing is probably too strong a word, at sort of looking at adherence to the health and safety protocols and encouraging one another to be in compliance. And we are working on continuing to position student voices, student to student voices, as being the most prominent in that space. And Marcom is doing a great job with that. But I do think in this moment, when we are in these restricted campus operations, it's very important that if you see something going on that doesn't seem in compliance to you, that you have that little moment of courage and say something, right? And that you ask students, are you on your way to a class? Are you on, you know, I mean, students can be out and about. They should be coming and going to academics. I wouldn't expect to be seeing too many gatherings that look like they're non-academic. And if you're seeing that, I would be asking about it. And encouraging, I mean, this is the only way this is going to work, is if we get all students to lower their level of interaction and activity on the campus.
A couple of more testing questions.
Mm-hmm.
For people who usually test twice a week, given the holiday next week, is once a week enough? Or should they squeeze 2 tests into the shortened week?
Next week.
Next week, the holiday, Thanksgiving week.
And it was a question about faculty and staff who normally test twice a week?
Yes.
I don't know the answer to that. I think, you know, if you're really only going to be on campus Monday and Tuesday, I think once a week is probably fine. But if you're normally, say, a Sunday, Tuesday tester, you could be a Sunday, Tuesday tester next week. It's kind of up to you, I think.
Thank you. There's some comment around the reduced testing days after the Thanksgiving break. Mm-hmm. Share a little insight on why it's reduced.
Because we expect there to be fully several thousand less people on the campus. And so the idea was to, I mean, we're paying money to have this done this way. And so the idea is to save a little bit of money and to cover in a way that still will give us the insight we need into the community. If that changes and we need to ramp it back up, we will obviously do that. But there's just going to be far fewer people on the campus, we expect, after Thanksgiving.
Thanks. And our last question, another perhaps optimistic one. Could a potential delay in the start of C-term impact graduation or commencement dates in 2021? It would.
We would end up pushing those out as well. It certainly would. And so again, that's why we got to look at it from all sides. We got to make that plan and look at it from all sides and understand what the real implications are. But again, if pushing it a little later could allow us to have it, you know, have more of a commencement, because it's that much more likely that vaccines would be widely available. At my mind, that's a chance worth taking. I see this last one about will a vaccine be required as well in the onboarding process? So there won't be vaccines available yet in January, I don't believe. I do expect that ultimately when vaccines are widely available, that we will require them for at least for students. We have not had a discussion about whether they would be required for faculty and staff. I would say I strongly, strongly, strongly recommend that every single person listening to the sound of my voice gets a vaccine when it's available. I trust our FDA not to approve something that's not safe. And by the time most of us are going to be able to get it, there'll be a ton of data on how it's going out in the broader community. So I would say we should all be planning on getting this vaccine sometime in the coming months, but I'd be surprised if it was available widely in time to impact the beginning of spring term. Folks, I want to thank you for being here with us this whole time and for all you're doing. These next few weeks are going to be intense, but there's a big break on the other side of them. So stick together, and happy Thanksgiving to you and your families. Be safe out there, and wear your mask. Bye, everybody. Oh, I just got a new mask, by the way. Hang on. One of the students I had office hours with today, she dropped these off even though the office hours were virtual. Here's the mask her mom made me with goats on it. Bye, everybody. Be well.